I'm Dr. Hunter Peterson, and this is Dr. Mia Grothman. We are naturopathic physicians of Coeur d'Alene Healing Arts, and this is Open Forum. So I like to start Open Forum always by asking who's new to Open Forum and never been to one? Okay, awesome. Yay. Welcome. As you saw, I turned the video camera on. We're recording this talk, so if you want to peruse it, share it with a friend. It'll be up on our website at cdahealingarts.com. And how the Open Forum works, I like to say it's a discussion, it's a dialogue. So, you know, periodically through the talk, we'll be pausing, asking you to give input, raise your hand. There's never a bad time to ask a question or kind of shift the trajectory of what we're talking about. There's no PowerPoint lecture, it's not formal, so let's just have it be a discussion, and I think that helps us stay more engaged and interested in you getting to learn what you want to know. So where we usually start is by taking a little bit of time to just survey the audience about any health-related topic you'd like to learn about or kind of pick our brains about. And what I'll do with that is Dr. Mia and I will stick around at the end of the more formal topic and go over each of those topics. So I want to open the floor for that and just hear what kind of questions are out there for you guys. So let's start. Yeah?
I'm curious about Candida.
Candida.
Overpopulation of yeast and whether it really does control your brain.
Sure. Yeah, and I think we'll catch it pretty good in the topic today. So yeah, we'll get to that. What else? Yes.
I have a question on your handout with the immune support. If you could talk about the difference with liquid D3 versus capsule, and the same with vitamin C powder versus the tablets.
Okay. Just in relation to how you use those compounds?
Yeah. Why do you recommend the liquid as opposed to a capsule?
Okay.
And
Yeah.
vice versa?
Vitamin C and D forms. Okay, sure. Yeah.
Mental health.
Mental health, big topic. So help me zone in a little more on like kind of what curiosity you have around mental health.
How it affects, how your gut affects.
Oh yeah, I think that's going to be embedded in what I talk about. So
Okay.
great question, and we'll chat about it.
Okay.
Yes.
Coronavirus?
Yeah. I know. Well,
I thought maybe that'd be on the top.
well, you know, actually we're just going to launch straight into that before the topic that you guys saw advertised. So we're coming to that. Yeah, for sure. Yes.
Fermentation?
Fermentation? Yeah, sure.
Sauerkraut.
Yeah. Yeah, and I'm not even going to write that because I'm going to talk about that in the topic. Yeah. Yes.
Can you address a new supplement that seems to be all the rage, black seed oil or black cumin seed oil or something? Are you familiar with that?
I'm a little bit familiar with it. I can speak to what I know, and Dr. Manning a little bit. Yeah. I'll say the little bit I do know. Okay. Yeah.
What about SIBO? Like, how do you control SIBO? Small intestinal bacteria.
Yeah. I'll write that down. I don't know if I'm going to really directly address SIBO, so I'll just make sure we get to it if we don't. Yeah. Small intestine bacterial overgrowth is what that stands for. Yeah, what else? What other questions? Yes?
I see there's multiple types of potassium supplements. What's the best type for hydration and cramps, muscle cramps?
Mm-hmm. Okay. Yeah.
Can I be
Coral.
a bad guy and ask a topic, something that's off topic?
There's no such thing. It could be whatever. That's the point of right
So
now.
I'm gonna do the trigger word. What are you doing? What are the things we can do for the coronavirus?
Yeah. You must have dropped in right after Brian asked. We're gonna get to that right in a sec. Yes. Any others? Yes.
What supplements you should kind of take on a daily basis? I mean, I know it varies per person, but your recommendations.
Okay. It is individual, but maybe we could give like a top tier. Yeah. Cool. Yes.
Bouncing off of hers, if it's individual, how do we find our individual?
Yeah. To come talk to one of us, maybe. Yeah. Yeah. Any others? Yes.
And like
yeah.
with, so like maybe Western medicine practice versus naturopathic practice, as far as like when we come see you, do you ask like, so what has your diet been like?
Yeah, yeah.
Because you are what you eat?
Yeah, yeah, I can share about just, like ND philosophy visit. And maybe I could kind of start a little bit with that to kind of share with everyone. Some are patients, but I know a lot of you aren't.
And to go off that one, how do you get that inflammation under control?
What's that?
How to get the inflammation under
Oh,
control?
yeah. I think a lot of the, lecture tonight is going to revolve around inflammation concepts.
Okay.
We'll talk about that. Yes?
Like acid reflux, how we can help that without having to take much medication.
Sure. Yeah, that's a good one. Cool. Yeah. Yes, Ellen?
Does the whole food plant-based diet have anything to do with gut-brain?
Yeah, I think we're going to get to talking about that for sure. Absolutely, the answer is yes. Yeah. Any others? Yes.
I guess, so I was tested for food allergies with the IgG test.
Mm-hmm.
Does that change over time, or is that the best indicator of food allergies?
Yeah, good. Really good question. I'll parse that out from my understanding of that test, which we're quite familiar with. Yeah. Yeah. Anything else? Any last topics? Okay, cool. So as promised, I think everyone's dying to know what the naturopaths think about the current epidemic disease process sweeping through the world. So I'm going to open the floor to actually have Dr. Mia lead the topic, and I'll contribute, and just again, let's make a little discussion and go from there.
Yeah, so obviously a lot of hype and a lot of news in the media right now about the coronavirus. I think it is always a little bit, yeah, go ahead.
Sorry, it's a little difficult to hear you.
Sure. Yeah, I'll try to project, just let me know if you can't hear me in the back. But yeah, a lot of hype and just a lot of media coverage of the coronavirus recently, which I think just kind of adds to a lot of fear and uncertainty and unknowns about what that really means. And unfortunately, I think that really kind of can feed to skew our perspective in terms of health and infectious disease when we're talking about one particular viral strain in particular, and kind of how that's spreading when we're often met with different viruses and bacteria on a regular basis. So I think it's just challenging to kind of address and engage with social media or just the news and different articles that are coming out, and also just trying to rein in kind of what perspective that is. I think overall, what can be pretty commonly agreed upon is that in general, very low risk at this point in the United States, and especially in our community, pretty low risk for contracting the virus itself. Coronaviruses in general are a group and type of viral strains. The majority of those coronavirus strains are responsible for the common cold. Back, I think it was 2003, there was a specific variant of the coronavirus, which was called the SARS virus, which was a pandemic, again, pretty more alarming media coverage virus that did spread to different countries, that did have a higher mortality rate, so more complications and death rate from contracting that virus, and I think it was closer to about 10%. What we're seeing with the current coronavirus that started in Wuhan, China, I think the mortality rate is closer to about 2%, and I'm pretty sure exclusively people who have had complications or have died from contracting the virus have already had either immunocompromised or in elderly populations, so already having kind of some immune dysfunction already before contracting the actual virus. So I think that that's really important to contextualize and understand. And I think as naturopathic physicians, we really want to appreciate and understand, supporting someone's immune function and immune response in general, and not necessarily take a fear-based approach and want to just disinfect every surface. I mean, I think it's important for our immune systems to become in contact with different viruses and bacteria and have a healthy immune response to it. Anything else you kind of want to say on that in particular?
No, I mean, I guess, Dr. Mia makes a good point that, there's a bit of a irony or paradox in that, one of the things that suppresses immunity more than anything is the mind's projection of stress. So fear is emotionally a big component of a stress response. And so, what we're fearful about the future, which we can't really do anything about right now. So I like to really spin the focus onto, what is this an opportunity for us to do, which is to be really self-reflective about how we look to our own immune system, our own vitality, and what forces are critical in, really having this vigorous, capable, intelligent immune system. I mean, tonight's topic's a great lecture for that, right? The gut and food relationships and nutrition, but, sleep and our stress response and how overextended we are in life. I mean, these are just some of the core things, how much we're moving our body, how much we're exercising, keeping our circulatory system active, which is critical for immunity. The really, really basic things, hydration. So those are the types of things that maybe this could be a catalyst for really setting some intentions personally around for all of us to really grow around. The hygienic part of this is very incomplete because really I think it's important to mention a concept of disease, and there's actually two theories that are very crucial as demarcating points of philosophy. One is known as the germ theory, and the whole media approach, Western medical approach to the coronavirus is very based on germ theory, right? So the idea is all on microbe equals disease. So it's all about not spreading it, washing your hands, having hygienic practices so you don't get exposed to the bug. Because if you get exposed to the bug, you're going to get the disease. That's entirely inaccurate, and I think the more accurate theory that explains it is what's called a terrain theory. The terrain theory states that you not only need the microbe to cause disease, but you need a susceptible terrain. This is the terrain, right? It is our bodies. So if our bodies are full of toxins and sugar and stressed out and lowered immunity and not sleeping, our terrain, our soil is going to be a lot more susceptible for those bugs to hang in there and multiply. So really that theory is much more what, as naturopathic physicians, we're focused on is, yeah, well, of course we care about the hygiene. We want you to wash your hands and stay home if you're sick, This is all good sense, but let's work on really creating robust immunity, removing toxic burden from our bodies so that we are not susceptible hosts, whether it's the coronavirus or, any infinite number of viruses and bacteria that are in this room right now. So I think those are some really salient points to remember. Yeah, Coral.
Is there a homeopathic, have they created an also for it?
I think my line about that is that if patients are talking to our clinic individually that are established patients, that's a good conversation to have with our staff. But generally what we will be doing, and I know that some of you guys signed in that maybe aren't patients, is we have a email kind of newsletter that we send out about open forums and detoxes and all sorts of cool things the clinic's doing. Next week we will be sending out a really formal, pretty thorough email with resources, with links, videos, with a whole host of immune kind of supportive therapeutics to be considered. And a lot of that's readily available at the counter. You don't need to be a patient. They're also available at the clinic. And so that's going to be a piece of information to share with all of you that I think will be helpful in further clarifying. And of course, like if you're sick and you really feel like this is kind of like worrisome about your level of sickness, come in and come see us. You don't need to go in to be quarantined necessarily. Dr. Mia and I treat, especially this time of year, acute individuals all the time for, you know, head to toe symptoms. So if you're really concerned or there's a higher severity of your cold or illness, come in and see us and call us up. We leave time in our schedules for acutes. Yeah, so any other kind of questions to kind of build off the coronavirus? No, it's a big deal, so feel free. Yeah.
You touched on the cleaning surfaces thing, and I'm interested in when you're staying healthy and you're trying to stay healthy, is that the time to pull out the bleach or Lysol or, you know, use something different than just your vinegar?
I don't personally feel that way. That's a personal belief, but yeah.
I think just general.
Normal.
I don't think we need to disinfect every corner of our lives. I think just general hygiene practices and, you know, being mindful, I think especially of our really high volume kind of touch contacts like our phones and things like that, to make sure, you know, we clean those and wash our hands, and if we're out in public or in interacting with a lot of different people, that's just a great hygiene practice in general, but not to do it in a sense or to a degree that it's going to inspire more fear or anxiety. But I guess, I don't know if that answers your question of just general, I wouldn't go to any further extreme, but other than just kind of basic hygiene. As well as I know there's been a lot of questions around masks and things like that, and I don't think that that's a really necessary step to take, and to leave those resources to the individuals who are really engaging, you know, on the front line, so to speak, with the virus and patients who are actually infected. So I don't think that that's a measure that we need to take as a community in general.
Yeah, I mean, a little history lesson. This is, as Dr. Mia mentioned, 10 years ago, something happened on a smaller scale. It's been happening through human history, these types of pandemics, and there was one very similar to this about 100 years ago, Spanish flu of 1918. It killed a lot of people worldwide. We also didn't have nearly the medical tools we have now. You know, it's very possible, it's probably likely that this is going to spread around, and it's very communicable. So it's more, again, I think the conversation we need to be having is about the terrain. And that's way more where a lot more light should be shined. And, you know, in that spirit, I think we're going to move into a conversation about terrain here in a second.
So I just had a question on that note. If we're taking care of ourselves, do you see a problem if we want to travel overseas to other countries?
I personally don't, but again, I would have to individually make that characterization, because I would, you know, ideally, if someone's immunocompromised or has chronic disease or lung-specific chronic disease, I would change my advice based on that. So I'll say that with a caveat. Yeah.
And I think in general, to speak to that there's a lot that we can do in general naturopathically to support immune function, respiratory function, as well as just kind of overall support and kind of the defense against different microbes. But we're in contact with them all the time.
Dr. Mia, you said that generally speaking, the mortality rate for coronavirus is about 2%. Generally speaking, what is mortality rate for influenza in general?
I think it's like 1%.
Yeah.
1%.
Half to 1%.
Yeah.
So it's a little bit more than
But just
the
like
general
just
influenza.
Right, exactly. And typically still, even with this current coronavirus, I think more commonly still the people who have complications or are dying from it have some degree of immunocompromise already.
And remember too that China vastly underreported their cases, so the current mortality rate is likely higher than it's going to settle out at, which, you know, very likely it'll just settle out right like any swine flu or, you know, kind of nasty flu bug that we've seen many times over. Yeah.
Maybe clarifying the difference between antibacterial versus antiviral. Right, this is a
Sure.
coronavirus and everyone wants to use hand sanitizer. Right, so that's more of a
Good point, yeah. Hand sanitizers don't do a great job of killing
Or
viruses.
like solar bleach or anything, so
Right.
maybe you could give a couple tips, or maybe you already will, on helping the terrain for that, so we can be attacking or boosting virally.
Yeah. Yeah, and conventionally, there is nothing. I mean, we basically prop up compromised organs that are failing in late stages. That's the only conventional treatment, whereas naturopathically, we have lots of great antiviral tools. So again, that handout we're going to be sending is going to go into depth. We could just, kind of list off, vitamin C, vitamin A, vitamin D are huge antiviral players. So those are some, we really love to use medicinal mushrooms at the clinic of good standardized hot water extracts. We really like to use antiviral herbs. We have a formulation, but Grindelia, Lomatium, I think another good one is licorice. What else is in that formula? Some mullein, golden seal, bloodroot. These are just all awesome herbs you can get in tincture form, great antivirals. We can use echinacea, we can use zinc. So again, really good stuff, and that newsletter will outline, from our perspective, some of the great stuff to consider.
On that subject of antibacterial, I believe hearing a long time ago that antibacterial soap is actually not great, but that it's still being used in a lot of public places. Do you have any?
Well, I mean, not great depends on what you're trying to talk about.
Like it clears out things that could be helping your immune system as well as things that could be hurting, I think is what I had heard.
Well, the skin is a mucus, it's not a mucus membrane, but it's a membrane surface that's ultimately a reflection of your gut. And so, the balance of the flora on our skin is, in a lot of ways protective. I mean, the microbes have actual immunologically protective effects when they're in balance. That's the key, and we're going to talk tons about that today. So, theoretically, an antibacterial sanitizer wipes out, kind of like clears it, and then how it grows back and repopulates, then, it's a little bit of it can be problematic, I'll just put it that way, for some people.
I would add to that just to say that there's a time and a place and a use for, hand sanitizers and antimicrobial types of supports, but I mean, I feel like there's so many great studies and research out of just, having kids play in the dirt, or, lower rates of allergies for people who have dogs and pets in the house, and just, I think part of how our immune system develops and is cultivated is still to have interactions with microbes, and just to really acknowledge like our own microbiome that we have in our gut. And I know Dr. Hartel will get more into that, of just still having that kind of synergistic interaction with the rest of our environment is still very normal and healthy, and I think overall in benefit to us when in balance and we do have a healthy immune system.
Cool. I feel like that's a pretty good transition point to the topic that we're going to kind of hit tonight. So yeah, does everyone feel like hopefully a little bit reassured, less worried than they were 10 minutes ago? Hopefully that was helpful. So, everyone ready to launch into gut brain? Okay, cool. Thanks, Dr. As I said, we'll come back to these guys. So yeah, let me actually make this initial statement. Someone wanted to talk about, a naturopathic physician and what we do and how we understand health. And so, I think the gut-brain connection is a really good example of a really strong philosophy and paradigm that we ascribe to, which is that when we work with individuals, we are very interested in treating the whole person. I think there's been a schism and a kind of like separation in the world of health and well-being that has happened, especially in regards to physical health and mental, emotional health. This topic is so great because it actually is all about the connection between them. But I think it just illustrates too that, we want to understand every aspect about what informs your well-being. So in a new patient visit, we'll go into genetics, we'll go into family and personal history. We might do a lot of scientific testing and stuff that conventional docs do and stuff that only naturopathic doctors do. We'll do physical exams to really look at everything, and we'll talk deeply about your medical history. But we'll also talk about your spiritual well-being, your emotional well-being, your relationships, how the forces of your life influence the way you move through the world. And I think that in order to be really good allies and partners in your health journey, it's important that we get to know our patients, somewhat intimately and broadly, because every person, in order to help aid their health journey, needs a unique approach offered that really fits their unique nature. And I mean that genetically, I mean that physically, I mean that mentally, emotionally. And so we're really blessed in our training that we spend a lot of extra time connecting to those arenas of health and well-being. And personally for me, I find in my own journey, as well as that with patients, that the mental emotional component of health is a really big deal. And it influences a lot of our physical behaviors. I initially was really hardcore about diet with all my patients, and a lot of them didn't come back because I think there was this lack of appreciation on my part until my own healing journey to really appreciate how, well, for a lot of people, how they eat is very much a little bit related to their emotional state and how they cope with the world and the patterns that they've developed in their lifetime, and just the reflexes those create. So all is to say that it's very, very complicated. We are very complicated, and in order to have help with your health, you're really deserving of a comprehensive conversation that takes the time to go even into your family of origin, what life was like growing up, and what your experience from infancy onward has made to create who you are today. So I think when you work with a naturopathic physician, we're really interested in that big picture, and we're also really interested in where patterns of dysfunction develop. And I'll say this term, treating the cause, but your symptoms are clues. That's what they are, even though they can be limiting and difficult to kind of be in relationship with. They teach us about what is underlying, where a pattern gets created, and where dysfunction arises from. Our bodies are inherently intelligent, so they're really designed to work incredibly well. So when things aren't, then we have to understand what has gotten in the way. And looking for those root causes, again, really complements really nicely that whole person conversation, because maybe sometimes it is gut related, but maybe sometimes it is a trauma that's happened in life. And maybe other times there's a genetic component that we have to evaluate and understand. So we always are seeking that question of how did you come to be this way, and what are the causational forces? So that's really important to me. And if I look at causational forces, I would say largely this idea of gut health, naturopathically speaking, is a big, big deal. And so, I would call naturopathic physicians, first and foremost, if you had to pick an organ system that there's a lot of proficiency, I would say the digestive system is really where we have a lot of training and a lot of ability to uniquely help people. It's a little complicated because we're all individual as practitioners. That's also part of our profession. We don't have a rigid standard of care, which is very freeing and helps our patients, but also makes it hard for you folks as patients to know, well, this naturopath, am I going to get the same experience? Probably not. They may have a totally different perspective and viewpoint and way of practicing. So all I can really speak to is my approach, Dr. Mia's approach to a large degree. We're really on the same page in how we look at health. So with this idea of intestinal health, I think maybe before we dive into that, we should link the topic, which is gut-brain connection. And really a lot of what has promoted this topic into a buzzword is that some really prominent physicians, researchers, scientists have been able to pull together some information and some observations, in clinical trials and just, cross sections of society to recognize that a lot of these mental health diseases are showing huge functional correlation to existing disturbances in digestive health. So when we talk about, what mental health, I'm talking about autism spectrum, I'm talking about schizophrenia, bipolar, I'm talking about brain fog and other memory loss, including dementia and Alzheimer's. I'm talking about anxiety, depression, all of these syndromes. There have been some really compelling research to show that one of the common underpinnings is that a vast subset of these people with the diagnosis of these mental health conditions have pretty active signs of disturbances in digestive function. Okay. So, for the curious observer of that, it leads us to say, well, what is that connection and how does that all come about? And so I want to talk about that tonight. So really what I'm going to do next is actually spend quite a bit of the next bit of time talking about the digestive system. I'm going to spend a little time tonight talking about how the brain influences the digestive system, but that's not the main thrust of the topic, so we'll get to that in turn. Let's start with the gut. And so when starting with the gut, I'm just going to give a 2-minute breakdown of digestive physiology so that those of you who haven't taken a physiology course can just understand how this digestive process works. And so, the way to lay this out is you have this big tube in your body from your mouth to your anus. It's about 28 feet long. And the time it takes for the food that you eat to go from your mouth to your poop is about, in a healthy body, 18 to 36 hours in a healthy body. Of that time, I'll kind of break down where food spends the most time as we go through the process. So when we eat our food, the process of digestion starts. It starts because the saliva in our mouth has enzymes in it to break down starches. Half of starch digestion happens in the mouth, actually, if you chew your food. If you don't, you miss out on a lot of that. Chewing, and it's called masticating, is also a way to basically break down the surface area of your food. So when it gets to the stomach and the intestines, it's much easier for enzymes and digestive juices to access. So food hygiene is a big thing I talk about with every patient, because if you don't chew your food, then you're already setting a compromise up in your digestive process. After you chew everything up, hopefully, into liquid, you swallow it, and then you move from a voluntary muscle response, swallowing, into involuntary as that food gets propelled down your esophagus, which is this tube that goes down into your stomach. At the bottom of the esophagus, there's a little sphincter that very well coordinates with your swallow to open to allow food and water into your stomach. And the stomach is this really acidic environment. It's a very hostile environment to microbes, which is good because the biggest exposure to the bugs we have through the outside world is what we put in our mouth. So our stomach kills off a lot of those bugs if we have good stomach acid, and that's also an if, right? Because a lot of people don't. When the food gets into the stomach and that esophageal sphincter closes, sloshes around, and you secrete pepsin and hydrochloric acid, gets activated in the stomach. And those acids, their primary digestive role is to break down proteins. So carbs and fats don't do much in the stomach, but protein starts to get broken down, and we start to be able to peel away the nutrients, the vitamins and minerals, for absorption later on in the system. Stomach acid is very important for that role. That's going on. The stomach part is maybe 45 minutes average. At the end of that period, the food shifts out of the stomach, and there's another sphincter that opens up into the small intestine. And a small intestine is where most absorptive function happens. So the food is going to break down further in the small intestine, and it's going to be absorbed in the small intestine. Most water is actually absorbed there too. And we're going to come back to the small intestine and spend a lot of time there tonight, but generally it's an absorptive organ. And to illustrate its absorptive capacity, the nature of the digestive lining in the small intestine has these little finger-like projections. So when you spread the surface area of that out, each of our small intestine has a surface area literally the size of a football field. So there's a big absorptive function happening there. And there's a lot to keeping that absorptive process healthy. In a lot of ways it can go wrong. So that's a big part of the topic. That takes about 3 to 6 hours for food to move through the small intestine. And then it enters the large intestine through another valve, the IC valve, and also known as the colon. Colon is only about 3 or 4 feet long, whereas the small intestine is like 20 feet long. And the colon is also much wider in diameter. It also has got a lot more bugs in it. There's like, almost 4 pounds of bacteria and microbes in our large intestine. And that's actually where food spends the most time. And really what's happening there's a little bit of vitamin extraction, and there's a little more dehydration happening in the colon for waste to move from liquid to solid. And that process takes about 18 hours, or 18 to 20 hours in the typical person. And what's propelling the food all the way through is all this involuntary muscle in our body. It's a term called motility. So you have muscles that our brain doesn't control that's kind of just moving things along in bursts and starts and slowly toward the colon, where then at the rectum, obviously, voluntary muscle returns. And you eliminate the waste that way. I've skipped over a few organs, which are the liver, the pancreas, and the gallbladder. Those are very important digestive associated organs, and they have a major role to play specifically with breakdown of food. So I'll start with the pancreas, which is kind of strange looking organ that's kind of hidden. The pancreas has what's called exocrine and endocrine function. I'm going to talk about the digestive exocrine function. And what its job is to secrete enzymes into the top of the small intestine to break down fats, proteins, and carbohydrates. So those enzymes cleave bonds within those constituents, so we get them into nice and small particles that can then get absorbed into the bloodstream. The liver is responsible for making bile, and bile is a way for the liver to dump toxins into the gut, and then if we're eating a nice high fiber diet, we're carrying that bile out in our poop. That's what makes it brown, is that bile, the dead red blood cells, the toxins. But bile also has a major role in helping fat be micellized or converted into a soluble form that can be brought into the bloodstream. So that's the digestive absorption role of bile, is to basically help absorb our fats that we eat in our diet. And it's important to note that the gallbladder is really not making any compounds, but it is a storage tank for fat or bile. So whenever we eat a meal, our gallbladder squirts a bunch of bile into the small intestine to help that fat absorption happen. So when people don't have a gallbladder, there's a compromise in physiology there, and we definitely want to account for that if that's the case. So that was a real quick run through of digestive physiology, but I want to give everyone a lay of the land to kind of know what's happening when we consume food and how it goes. Questions around that?
How does the appendix function in that?
Yeah, appendix is part of the lower section of the small intestine, kind of right on the edge of the large intestine. In the last third of the small intestine has an increasingly large role immunologically to play. So the appendix is like an extra large lymph node, basically. It's an immune organ or immune tissue. And we're going to really get into that in a second because, you know, the immune system is mostly in your gut. About 80% of our immune system lives on the lining of the gut, and the biggest part of where it lives is right down there where the appendix is in the last third of the small intestine. You have these basically lymph nodes in your gut called Peyer's patches that are heavily immune oriented, and they key off of what's going on in the gut, and they key most specifically off of what's going on with the bugs in our gut. And that's a great segue to the next topic.
So why does someone get gallstones?
Gallstones? Well, gallstones have to do with basically a dysfunctional gallbladder, and there's a lot of reasons you can get them, but a lot of it's dietary. A standard American processed diet is a big contributor to gallstone. There is some genetic predisposition. Yeah.
So we're thinking of great description, by the way.
Yeah.
We're thinking of digestion from north to south, and gallbladder has a role. What do you find with high, you know, the ketogenic diet and high fat diets? So many people are very proactively going on without supporting biliary function.
Yeah.
What do you find?
I tend to be pretty prominent about supporting fat digestion in folks who are doing those really high fat diets. It's an individual question. Ultimately, some people do really great digesting fats. People with digestive insufficiency don't do as great, and I like to supplement, you know, various compounds that I have at the clinic, as well as lecithin is a pretty easy one to access over the counter. So it's a very wise thing to do with a lot of folks.
Right. My question, I guess, from that was, do you find that people with high fat diets, do you see more of a correlation with this gut-brain connection, or is that more to do with undigested carbohydrates?
Oh, not necessarily. No, I don't think the high fat is one of the main risk factors. I would say high refined starch is a much more strong risk factor. Yeah. Yeah.
What would you say is comparable with the appendix?
What is what with the appendix?
What would be comparable with the appendix as to what would cause it trouble to come out?
A really dysregulated gut and therefore immune system. I think when people get their appendix out, their doctors are always told, we don't know why they, you know, create problems. I'm like, I think I know why. I think because we have to really look much more closely at what's happening with your digestive physiology and your microbiome. Yeah, and which is a good segue. So I'm going to zoom back into the small intestine and large intestine, because even though we have microbes literally from our mouth to our anus, we're going to focus where most gut stuff in immune gut and brain axis related stuff is going on. And that's primarily in the small, large intestine, and even more so in the small intestine. So the term that I want to bring in to really make the small intestine a lot more complicated than how I described it is this term called microbiome. What is a microbiome? How do we define that? It is the community, the very large, insanely large community of microbes that live in all of our guts. To the tune of, we, cellularly speaking, are 90% gut bacteria, 10% us cells. There's 10 times more microbes in our gut than there are cells in our body. And it's a pretty strong awareness to have if you didn't know much about this topic. And so, can you imagine that these microbes have a pretty important role to play in our health? Yes, I think they do. And so, when we look at that, these microbes have essentially a massive role to play in digestion, a massive role to play in the health of the digestive canal, a massive role to play in immune system health, and a massive role to play in inflammation and protection of our body from harmful substances. So let's kind of get into that. You know how I talked about this big, football field-sized surface area of our gut? Well, what's surrounding that surface area, what are called enterocytes, in a healthy gut, and I'm going to talk about a healthy gut right now, is a carpet of bacteria. Literally, our small intestine and large intestine are carpeted in bacteria. And those bacteria are actually what the food that we ate interface with, what microbes get through our stomach. They interface with that bacteria first. And they also metabolize a lot of our food, turning it into nourishment for the cells of the intestinal lining, as well as making it accessible for us to absorb more readily. They activate vitamins, they synthesize vitamins, hugely important role with vitamin K, B vitamins. Gut flora is responsible for a lot of that synthesis. They also have all sorts of protective immune compounds, so they will kill pathological bugs, and they will absorb toxins that are coming into the intestinal canal. They also have this really powerful immune communication process going on. And that's where I'm getting into the immune system, which is going to tie into the brain stuff, which is that the immune system has all sorts of different types of cells in it, and it has all sorts of different regulatory mechanisms to say, this is harmful, this is friendly, this is a problem, this isn't a problem. And that relates to food, that relates to viruses and bacteria and parasites, etc. That relates to toxins, that relates to our own cells, right? I mean, everyone's heard of autoimmune disease. What's happening there is the immune system's so dysregulated, it's attacking itself. And ultimately, I think science is going to further validate, and already is, that our immune system's intelligence and functionality is informed more than anything else by its relationship with the flora in our gut. It makes sense, right? 80% of the immune cells are associated with the gut, and the gut is basically, you know, these trillions of organisms of bacteria. So there's a lot of communication and information being exchanged there. And when we talk about different immune responses, like Th1 versus Th2 is a term that comes up a lot. The Th2 is more the allergy response. It's more associated with eczema, skin issues, asthma, all the brain-related issues are much more associated with an overactivated Th2 response. Well, one of the ways that gets created is when the gut flora is really dysregulated and it tips the body more into a Th2 response. Another major immune constituent is called T regulatory cells, which regulate how the rest of your immune system works. Those Tregs are very informed by the gut flora, and so major relationship there. So when someone asked a question about inflammation, I mean, inflammation is the immune system being active, basically. That is what inflammation is. So absolutely, one of the ways that we modulate inflammation is we modulate how the immune system responds to inputs in its environment, which number one, first and foremost, is informed by the gut relationship. So when I'm treating allergies, either seasonal or food or anything kind of more allergically mediated, I'm always looking at the gut process and how to help that along. Any questions about some of the immune connection pieces? Yeah.
How do you know if you need probiotics? I mean,
Yeah.
probiotics only became big in the last few decades.
Yeah. Well, that's not necessarily true. Probiotics have been big forever. It's just that as humans, we have gotten really far away from probiotic food. So ancestrally, we would pull our food out of the ground and they'd be covered with probiotics. We don't do that anymore. We have highly sterilized, regulated food supply chains, so we don't get all those great beneficial soil-based organisms. Also, fermented food has, from human history, always been a part of our diet, and no longer so for the vast majority of people. So when you say probiotics, we're really, let's talk more about beneficial microbes. Probiotic supplements are a way you can do that in a convenient fashion. But the reality is, you know, having your own garden where you get your own veggies out and eat those, and, you know, eating fermented foods all the time is a completely adequate way to constantly be seeding your gut with good bugs. And I'll talk more about probiotics later. So these flora, as I said, this microbial community, the microbiome, I would bring to the categorization, kind of two subtypes. We have what are called commensal or beneficial microbes. And when I say microbes, I mean primarily bacteria, although there's some parasites in there and there's some fungal organisms in there. But mostly we're talking about bacteria. That's the vast majority of them. And so those beneficial commensals in a healthy gut are the primary species involved. There's another subset of microbes called opportunistic. We all have them. They're all part of even a healthy gut. But crucially, those opportunistic organisms do not cause a problem unless they become inordinately prolific in our intestinal lining. And our commensal beneficial microbes are really responsible for keeping the opportunistic species in check and keeping their colonizing to a level that doesn't harm that really nice carpeting of microbial lining in the gut. And so, all told, we've discovered like a couple of thousands of microbes in the gut. There's lots of different species. We'll probably discover many more over time. Some of the more prominent commensals or beneficials that you've probably heard of are Bifidobacterium, Lactobacillus, E. coli. Those are, types that are well known, but in reality there's several dozen known commensal beneficial flora. And they do all the good things we talked about. They feed the intestinal lining, they break down the vitamins, they protect the intestines, they help break down our food. But what happens when the gut gets dysfunctional is those opportunistic microbes take over a much larger share of the territory in the gut and some of the functionality of what we've ascribed to the microbiome starts to break down. And that's where we start to eventually move toward the systemic implications of problems in the gut. So let me kind of take you guys there because there's a few steps to this. I want to really elucidate this. So when those opportunistic microbes start to have a larger share of the space in the intestinal lining, then the lining itself is not nourished as well because those microbes are responsible for feeding the lining. And if the lining is not nourished, it starts to weaken and break down. And you actually start to lose the functionality of the barrier function of our gut, right? That lining, that tube inside of us protects us in a way from the outside world. And so if it breaks down, we're vulnerable to things passing into the bloodstream unobstructed that are toxins, incompletely broken down foods, viruses, bacteria, can now all move into the bloodstream. So if that lining gets compromised, not good. And we're needing the bacteria to keep the lining healthy. What also happens on that lining, by the way, is that a lot of our end stage digestive action or like enzymatic action for things like lactose, different types of grains, etc., happens right on that lining of the intestinal cells. So if those cells are wiped out or disrupted or compromised, we're losing a lot of our actual breakdown function intrinsic to those gut lining cells. Important to know. What also happens if that changes, if you get those opportunistic species, is they start really actively fermenting food and start basically producing metabolic byproducts. So the good bacteria produce metabolic byproducts that nourish and help our body. The opportunistic ones, when there's too much of it, produce toxins and compounds that are disruptive and inflammatory and destructive. So the combination of making the lining broken apart, or what's called leaky gut is another word for it, and then all of those microbes kicking off a bunch of toxins and waste products is a pretty bad combination. And this is where we start to get to some of the systemic manifestations of this process. Any questions there? Okay. So the ways that we get to this place, the question is, what are the causes? What are the forces that can disrupt the health of our digestive process and the microbiome. And I think this is the part where I'm going to mention the kind of mental health conversation and stress, because it is such a big player. And I will say in my clinical practice, because many of the folks who come to see me are already pretty conscious of how they eat and are, you know, are definitely on that path with food choices, and we'll get to food later, that a lot of what I see is the effects of chronic stress on intestinal function. So remember how I talked about the pancreas and the stomach and the gallbladder and liver, how they're really responsible for secreting all these enzymes to break down food? When we're in a stress response, like fight or flight, you know, the body signaling says, well, you need to survive, so don't worry about reproducing, don't worry about that cold you have, don't worry about digesting your food, because you need to make it so that you can go do all those things later in life. And in our ancestral way that we use our stress response, those were very short bursts, very infrequently. Now we live in a way where we have a lot of stimulus to the mind and a lot more complexity to our life from a mental standpoint. And mentally, emotionally, what I see is that many of us live in a chronic fight or flight state. So it's not just here and there little bursts. We're always in a tone from the mind talking to the nerves, talking to the body, where we're carrying that fight or flight message instead of that rest and digest message. And this is a big problem because what it does on a physical level, when the mind transmits that signal into the physical body, it totally curtails nerve output to the blood vessels and the organs and tissues of digestion. So all of that enzymatic breakdown absorption process has profound compromise. So you could be eating the most perfect whole foods, clean diet, and if you don't have that functionality, you can create enormous issues with the microbiome, with inflammation in the gut. And so from that standpoint, it's a really big deal. And a lot of the work we need to do individually is to recognize how uniquely that response is happening in someone's body and input modifications, maybe nutritionally / supplementally, but mostly recognizing what the ways, the pattern someone's programmed into thinking and relating to their environment. And I've done a lot of talks in open forum around these topics. You know, I did a nature versus nurture one. I did a, you know, stress, chronic stress, adrenals. So there's some really good places where you guys can dive into that if you want to listen about that topic in a lot more depth. But does everyone understand the principle of that, and why that's such a big deal? And how that could relate to like gut health and compromised gut health? Okay, cool. So that's one of the forces I'm always looking at. Another big thing to just acknowledge is how medical intervention can really harm the gut. Antibiotics are the big obvious one, right? So an antibiotic is something that's usually prescribed. It's a drug for like a bronchitis or a urinary tract infection or ear infection. And oftentimes, if it's an actual bacterial infection, it will clear your acute infectious process. But what's not communicated is that that antibiotic is not discriminating. And so this really important place of intelligence and health, which is your gut, it's going to go wipe out that flora in those tissues. And it's going to kill the good bugs, it's going to kill the bad bugs, but what we see ending up happening usually with antibiotics is those opportunistic microbes tend to really take hold a lot more quickly when you wipe the slate clean in the gut. And so it's a really, you know, really easy way to get dysbiosis, which is, again, I'll keep using this term dysbiosis because it's this imbalance of the microbiome. So antibiotics should be used very, very carefully and only at last resort. I think in my 7-year career, I've asked someone, and I don't even prescribe them, but I've asked someone to get them maybe a handful of times. And as I said, we treat, you know, everything serious, acute at our clinic. And so there's really very, very, very seldom a circumstance where that is absolutely necessary. And this is a big reason I'm very hesitant to use them, because there's such a compromising role it plays in our immune health, in our gut health, in our systemic health.
So let's just say somebody had to use an antibiotic at one time. I mean,
Sure.
so it suppresses the system, but for like how long?
Yeah, I mean, it's an individual question. So, you know, we could say that it has a long-term consequence indefinitely, but realistically, if someone's really thoughtful about restoring their gut flora, you know, the main effects of it could be mitigated within a couple of months. But it just really depends on the individual. And it depends on the amount of exposure, right? When I have even a pediatric come in and they're like, their parents say, well, they've been on, you know, about a dozen rounds of antibiotics a year for the last 5 years, it's going to be harder to heal their gut than if they've had, you know, a couple courses. And I'll even go back to the very beginning, and maybe I'll mention another major risk factor here for dysbiosis that contributes to gut flora, which is, you know, our prenatal and postnatal environment, right? When does the microbiome get created? It gets created when we come out of the vaginal canal. I mean, we're sterile when we're in utero, and we come out of the vaginal canal, and vaginal canal is a mucous membrane, so it has microbes in it, and there's a whole ecology and flora there. And when we come out, we get seeded with that flora, and that begins the process of, you know, creating the gut microbiome. So if we're not born vaginally, we got an issue, right? The microbes that end up seeding our gut are not the ones that nature intended, that are in vaginal flora, but now they're whatever's in the air, etc. And so that's a big catalyst for dysbiosis. So I'll actually have parents who have to do C-section take vaginal secretions and swab their baby's mouth after they're born, because at least we can kind of mimic the process. But, you know, also we have to bring in, even if they are vaginally delivered, what's mom's microbiome look like? How healthy is her flora? Because if it's really imbalanced, then they're going to pass along that imbalanced state to their child to some degree. And so that's why I really like to work with folks if we're doing, you know, kind of counseling around childbirth and just pregnancy and all of that, like start way before we even start getting pregnant to get a really healthy body that's going to sustain a good pregnancy, a good microbiome, etc. So very much, you know, the microbiome conversation begins from day one of life. And so to that degree, what predisposes dysbiosis, I think a lot of these individuals have that set up from the outset. What drugs was the mom given during childbirth? Was antibiotics issued, you know, etc. So it's important to remember this is a big force, at least to be cognizant of. Even if we can't change the past of what's happened, it can give us insight into how we got there. Yeah, question?
What relationship do vaccines have on the gut bacteria?
I'm not going to speculate too much on it because I don't have a real clear understanding of it. I think where vaccines are more prominent is how they interface with the immune system. So I would say more so, the thing I would argue is that the relationship between the gut bacteria and the immune system has a major role playing in how vaccines influence the body. So in other words, a healthy immune system is going to have a lot less trouble with vaccines than an unhealthy immune system. And the gut is really where that immune system is deriving most of its intelligence and health from. I don't think the other way around, the vaccine and how it impacts the gut microbiome is quite as prominent of a conversation. It might be mild, but I don't see it as a major...
Wouldn't be anything like antibiotics?
No, yeah. Yeah, let me mention a couple of the other, you know, drugs, you know, because I think there's some biggies too. Steroids, right? Everyone knows about steroids. We talk about suppressing inflammation. Conventional doctors love to use steroids. Oral steroids, especially, things that we swallow, have a major impact on depressing, repressing, dysfunctioning our gut microbiome. So I really like to avoid those if at all possible. things like proton pump inhibitors and antacids and acid blocking medication have a major detrimental role. Remember how I talked about how important stomach acid is to make sure bad bugs don't get into the intestines, and also how important it is to extract nutrients? Well, yeah, if you don't have that, it's going to make you susceptible to pathological, opportunistic bugs, really taking over. NSAIDs, really hard on the guts, so ibuprofen, aspirin, really kind of inflammatory action. And I mention those because they're so prolific. People take them all the time. They have other side effects too, but on the gut they do not do well. Chemotherapeutic agents, really rough on the gut. If we're talking about cancer, which is a subset of people, gut cells turn over really fast, and chemotherapeutics target fast turning over cells. So that's a major problematic area as well. Another thing that a lot of people would not necessarily link, but there's a lot of compelling research, is birth control. So oral birth control pills are really, really, really rough on the gut. And some of the women I see have been on it for decades maybe, and so we have to really take into account how problematic that can be on this pretty fragile ecosystem. So those are some of the other inputs in relation to kind of like external causes, medically speaking. I would say that the biggest thing, and we're going to talk the most about it tonight probably, is, the microbiome is influenced by the food we eat. It's pretty obvious, right? If they're metabolizing, helping us break down our food, the type of food and the quantity and the way it shows up in the gut is going to be a really big deal. So that's going to play a large role in whether the commensal beneficial bugs tend to hang around versus the opportunistic bugs really gain prominence. The observation and the science shows that whole foods, high fiber foods, tend to have a really promoting role for commensal beneficial flora. Processed foods, sugar, and starches tend to have a very promoting role for the opportunistic species. So if you want to just get really broad and basic, that's kind of the demarcation. I'm going to go into a lot more depth when I get into more treatments, because I think that it's important that we really illustrate, some clinical, practical ways where we can heal our gut microbiome through nutrition. So I'll go into a lot more depth in a little bit. But, from a principled standpoint, basically when we eat a lot of starch and sugar, those opportunistic flora actively metabolize it much more so and proliferate much more quickly. And as they metabolize it, they're creating all sorts of toxins and byproducts that get released into the gut, but then also, if your gut lining is compromised, into the bloodstream. And so that's really the process that then leads us into the whole conversation about the brain and how the brain is affected. So I want to make sure I answer, before I get into that, questions around causative forces disrupting or compromising our microbiome, and kind of, that whole topic. Brian?
How does, you talk about fight or flight effect.
Yeah.
How does that affect the microbe?
Yeah, it tends to indirectly, I think, really promote those opportunistic flora. Because when we're incompletely digesting food, then a lot of those opportunistic flora really, kind of capture that process and become much more active and proliferate a lot more. So I think it has a detrimental effect. Yeah.
Is there any of this that can be accounted, like, genetically, or?
Yeah. That's a good question. So I like to prefer to use the term predisposition or vulnerability, because a lot of people use the term genetic as if like we're helpless to the outcomes of our health, and I don't think that's true. But I do think that we are predisposed familially, genetically, ancestrally, to certain manifestations of of where we're vulnerable or weak or likely to manifest dysfunction. So I think some people digestively, that's a place where they manifest dysfunction and are vulnerable. Some people, it happens more in the psychological realm. Some people, you know, it happens in their muscles and joints.
Nature versus nurture.
Yeah, and there's nature versus nurture to that too. But, you know, so I would say that, yeah, like a lot of times what I'll see is people whose parents have gut issues, the kids have gut issues, or siblings, you know, and that's, and I think again, it's both your genetics and how you're nurtured, right? Because there's a lot of, even like we said, with being born with a mother with a compromised microbiome, you're gonna pass around a compromised microbiome to your kid. So there's, it's hard to discern that, and then it's hard to discern what environmentally, lifestyle-wise, you know, catapults you into a dysfunctional state. What we can control is that part, and so that's where we're going to talk mostly, because we can't really change our past. We can understand our past better, help it teach us how to live forward in our life in the best way, but we got to look at what all the forces are that influence our genetic expression. It's called epigenetics, and we know that 90% of our genetic expression is the environment we put our genes in.
EPI?
Epigenetics, yeah. It's just the theory that, well, and really the law, I mean, it's pretty clear to me that it's the environment that the genes are in that tells them how to express themselves. We did the Human Genome Project, we figured this out. So we have infinite capacity to manipulate our health based on the environment we put our, you know, our body into. And that includes the food we put in our body, et cetera. Yeah.
So would any kind of cleanse or a fast be a good recommendation in terms of kind of resetting that gut bacteria?
Yeah, it's a good question. When we segue into treatments, I'll just mention it now. One of my favorite ways to do gut healing is to use principles of fasting. And the reason I say that is because, you know, one of the things about our digestive tract, especially in our modern way of living, is that we're constantly eating. You know, people eat from when they wake up, practically when they go to bed. And when you're constantly eating, you're constantly digesting. And so if the gut and the organs associated with that are focused on that process, there's not a lot of bandwidth for regeneration and repair to be happening. It's happening, but it's, you know, not at the highest rate possible. And human physiology is really well adapted to the fasting state. And we have a lot of compelling research that when we're in the fasting state, we have a lot more active metabolic activity of regenerative processes on all cellular levels, but particularly in the gut. So one of the treatments in healing gut-related diseases is either intermittent fasting or limited frequency of eating, or actually doing outright modified fasts or water fasts. And I tend to lean more towards modified fasts, which are like bone broth fasts and vegetable juice fasts, which essentially allow nutrients to still flow into our body while still giving the digestive system rest. I wanted to mention for this lecture, because I usually do an intro lecture in April, we do actually a very thoughtful physician-guided detox fast in the end of April here at Pilgrims. It's 2 Thursdays in a row and then the Sunday in between. And we really walk a group through a process of how to safely and thoughtfully do medical fasting and really understand all the principles of that and support you through that process. I think it's great for the gut. A lot of people report dramatic improvements in gut health, and we just kind of individually walk you through that. So that's something you need to be a patient to do, and just something to just keep in mind that it is available through our clinic. But fasting itself can be a great tool if done appropriately. I'm really careful to just say, go to the Master Cleanse or go find something online, because you really do, it's important to learn how to appropriately use fasting to get the best benefits out of it. Yeah.
Are there any conditions that shouldn't show up for that fasting presentation? You know, like
Yeah,
Diabetes or-
pediatrics and pregnant individuals.
Oh, okay.
And then just there's like liver disease, I want to talk with people before they sign up. But if you had a concern, you could always ask me. But diabetics and any chronic disease tends to be fine as long as we account for individual adjustments if necessary.
And you just do the vegetable drink and bone broth in your fasting?
Well, there's a lot to it. I'm not going to go into depth, but you know, those are ways to fast without completely restricting all nourishment versus water.
Okay.
Yeah.
So that's something that's good timing, we're coming into the end of April and thinking about fasting.
Yeah.
So if someone is thinking about doing that in April with you or
Yeah.
try to do it on their own,
Yeah.
and wanting to make sure all their pathways, the detox pathways are open,
Yeah.
maybe you could highlight on some ways, because
Well,
obviously if someone's constipated,
yeah.
and detox, it's not.
You know, I would, except there's so much we got to get through that's totally part of being in the class, as part of really working individually through all the eliminatory pathways, opening up what are called the organs of emunctory to allow toxins to move out. So I get that it has to be individualized, and when those problems arise, we have to account for them. Yeah. So let me draw this connection up to the brain here. Okay, so we got this idea of leaky gut, right? And leaky gut is really, to me, synonymous with dysbiosis, synonymous with, you know, IBS, right? Like you have all these terms for the digestive system, but really like the one mother term for it is leaky gut dysbiosis, and I think it really fits most cases. Now the accompanying symptoms might be, you may have bloating, you may have gas, you may have constipation, you may have diarrhea, you may have abdominal pain, you may have fullness, you may have, you know, heartburn, gallbladder dysfunction. There's all these different symptoms, and we need to really individually be careful to assess those things. But generally, we can kind of fit it under that category. And there's ways you can test too. I mean, so you can do stool tests, upper endoscopy, lower endoscopy, which is colonoscopy. You know, those are like going to more catch super severe pathologies. I don't recommend that to very many of my patients. I can learn a lot from their symptoms. But occasionally when we're really stuck, I'll do, you know, some stool testing. There's ways to actually like culture the microbes. You can also put DNA probes, which is a more modern, newer way to really actually assess the microbiome. And that can be insightful in those challenging cases. It's very expensive, and I often don't find a ton of new information that my expertise doesn't give me guidance clinically to know where we need to go. So it's rare that I do this, but they do exist, and I have access to them, and they can be helpful. There's also breath tests. Someone mentioned overgrowth in the small intestines. You can breathe into a tube, and if you have certain fermentation products, it can tell you that you have basically overgrowth or dysbiosis in your small intestine. That's a test we do sometimes too. There's not a lot of blood markers to really like assess intestinal health. There's some things that we can kind of get an idea, especially we can look kind of at liver function, and if the liver is inflamed, it can often hint that there's some, you know, liver, gallbladder, gut issues. But those are just some of the ways that we do assessment, and I want to mention that. And then there's plenty of people who really need help in their gut, but their body doesn't present clinically with actual digestive symptoms. That's either because they're not very sensitive and really in their body and conscious of their body, which plenty of people I work with I would categorize as that, or their digestive system is just not a really vulnerable organ system, and the more downstream systemic consequences of disturbed gut is more where we're going to see the issues arise. Does that make sense? Okay. So let's talk about the systemic conversation and what happens. So if you got the leaky gut, then all of the byproducts that are being produced by the opportunistic flora are flowing, or many of them are flowing into the bloodstream. They're not having that protective barrier. You're also having incompletely digested food flow into the bloodstream. And the problem with both of those things is that the immune system doesn't like that. It sees those things as hostile. a really appropriately broken down, food is not harmful or concerning to the immune system, but an incompletely digested food is. And those toxins are not friendly to the immune system, it's going to react to it. So on one level, systemically, you can have these compounds moving into the bloodstream and kicking off an inflammatory response. That may happen in the joints, that may happen in the muscles, that may happen, in all sorts of different tissue, but one of the places where it also goes is into the brain. And like the barrier function in the gut, the brain also has a barrier function, but also like the gut, what research has shown us is when the intestinal barrier is compromised and broken and leaky, the blood-brain barrier gets broken and leaky. So what someone might say, well, those compounds won't get into the brain, but if you have a leaky blood-brain barrier, they will. So a lot of these incompletely digested foods, a lot of these toxins can move into the brain. And even with this leaky gut, you'll have whole microbes start to move into the bloodstream too. And there's a lot of research that's showing us now that indeed the brain is not quite as privileged as we think it is. And there's actually evidence of a microbial ecosystem going on in the brain too. And that's really new research, but nevertheless something to mention that definitely that microbial population in the brain has some effect on how our brain communicates, works, functions. And another thing to point out is when people are having dysbiosis, they're also become malnourished. I mean, they're not actually getting the nutrients into their body, the vitamins and minerals into their body, synthesized and absorbed appropriately. So one of the big, outcomes of that is, actual nutrient deficiencies on the level of the brain, right? We're going to have vitamin deficiencies, mineral deficiencies, amino acid deficiencies, which are really like the building blocks of all of our neurotransmitters and hormones. So you kind of have this double attack of inflammation, toxins, incompletely digested foods, immune response, and then a brain being starved of nutrients. And so when we talk about all of these brain conditions or brain-related diagnoses like depression, anxiety, autism spectrum, schizophrenia, bipolar, brain fog, we could see how this gut-brain process is having a big role in terms of brain functionality. And speaking of neurotransmitters, I should also mention that serotonin and dopamine, which everyone's heard those terms, I think, they're two big neurotransmitters responsible for all sorts of communication, mood, emotional regulation. Serotonin's 90% made in the gut, and dopamine's about 60% made in the gut. So when you get put on antidepressants that artificially increase serotonin levels, it's like, oh yeah, because your gut's messed up, so it's not making any. So we're going to flood your system with this artificial substance to, make more. But my preference would be let's go right back to the source, repair that, and regenerate the inherent function of how the gut nourishes the brain with those functionalities. Another very interesting thing is you guys would probably think about, gluten and dairy, and like a lot of people have heard about how those can be problems. Well, there's some very interesting brain chemistry observations where we actually scientifically observed that those incompletely digested, that's the key word, incompletely digested casein and gluten actually bind up to opiate receptors in the brain. So when you see these kids with like autism spectrum or gut issues, and they're like very picky and they're very, attached to their foods, you have to have compassion for them because they're actually, it's like they're addicted even at the level of the brain to those substances that are binding their opiate receptors. And of course, that's not a good process in and of itself to have that going on. Interesting though, that we've actually found that research out to be true. So So at the level of the brain, when you have this huge inflammatory process going on, you can see that it really dysregulates a lot of the functionality. And I think that's where we see the gut-brain connection, the gut-mediated effects on brain health. And, you know, again, I could go into a lot of depth physiologically and get like really, really specific, but I want to illustrate the concept to you guys and to say that, you know, focusing on this can be a really big deal, even if you don't have those diagnoses, to improve the functionality and sharpness and efficiency of the brain. You know, getting those nutrients there from a healthy gut dynamic, getting a healthy gut barrier so you're not bringing those inflammatory compounds into the brain is very important, and something we should all desire to, you know, achieve, I guess, with our health. So any question about the connection part? Yeah.
As of about 6 or 7 years ago, every time I eat sugar, I mean, any kind of sugar, within about 15 minutes, I'm sludgy, and within a half an hour, I have to be asleep.
Yeah.
I mean, it puts me in a coma.
Yeah, yeah.
And it's just sugar. It's like, I mean, it's a piece of chocolate that somebody gives me, I can't eat it.
Yeah.
You know, is that what you're talking about?
Yeah, I mean, it's sugar mediated through this process, right, that we talked about.
Right.
Yeah. Because again, you know, it's not just the sugar itself, it's how the sugar interfaces with the digestive process and microbiome and the downstream actions that's causing that functionality. And it also has to do with blood sugar a little bit. I mean, there's some other metabolic things going on, but I think it's a lot of what we've been talking about. Yeah.
Well, if it's the brain-gut connection,
Yeah.
and does neurofeedback come into this any while you're trying to adjust your gut?
Yeah, I wouldn't really talk about neurofeedback in this context. When you get into those lectures about, you know, the mind, mental, emotional health, I love to talk about neurofeedback. It's a cool modality, but not really as pertains to kind of the thesis of this lecture. Yeah. Maybe from a stress standpoint, it could be helpful. Yeah.
What was the other protein that you listed along with casein that binds with the opioid receptor?
Gluten.
Oh, gluten. Okay.
Yeah, it's not technically well, it's kind of a protein, but yeah.
What did you call them?
Gluteomorphins and caseomorphines, because they're binding morphine-like receptors. Yeah. Yeah. So, okay, I know we're a little short on time because we did that intro thing, but I'm going to go into what you guys probably want to hear a lot about is how can we engage this? How can we heal the gut? How can we work on that functionality? And I want to, you know, first mention, of course, avoidance of the medical interventions and drugs, right? It's a big deal. Starting from the get-go with our kids, if we can, is a big deal. Then I think really looking at diet, really stress, and we had that whole conversation, but then looking at diet and seeing what is appropriate. And that's ultimately an individual question, so I have to always give that caveat that, like, not saying what I'm going to say is right for everybody, but generally in my clinical practice with compromised gut health, microbiome, leaky gut, I found this approach to be helpful. And most generally, like, we could just talk about gradation, right? You know, if you're going to make changes, any change toward a healthier state is a good change. So always want to make that really sink in, because say you're eating a lot of processed food right now and you're eating a lot of sugar, and you know, you make a commitment to let go of that, then if you do that alone, you could fix maybe 70% of your gut issues and heal your microbiome and lining 70%. So you don't need to necessarily go all the way. People with more chronic and severe intestinal pathologies may need to go a little further. So generally, you know, what are the processed foods, right? So they're grain-derived things, and I'm going to include in the grain-derived two foods, which is corn and potato, which are basically grains. All of the refined versions of those. So you got your pastas and your chips and your crackers and your cereals and your breads, and then you have all the boxed things that, you know, are derived from that, and then you have all of your like sweetened types of things. So, you know, processed fruit stuff, sugars, sweetened beverages, alcoholic beverages is a refined, sugar. And all of those concentrated starches with very little fiber tend to really, again, feed those opportunistic flora. So those types of foods, which for the standard American diet is like the majority of the standard American diet, are the most detrimental and are going to lead to this situation the quickest. So we can remove those, we've made a huge inroad. I would say for the vast majority of people with disrupted guts, that cow dairy is going to be pretty difficult to digest. It's a very complex molecule, and it also, the enzymes to break it down are along the gut lining, which when it's damaged, it's totally stripped off. So most people are going to do better with lower cow dairy intake. Maybe if we get into the world of like fermented dairy, like really good home fermented yogurt or 24-hour fermented yogurt, a little bit different story because that's a lot pre-digested. Plus you get all the good bugs with it. So those are, some of the biggest culprits. I would also say that, any sort of like heavy fruit diet that's like, especially higher sugar fruit, like grapes, and pineapple, and dates, those can be somewhat problematic. Really high sugar concentration dried fruit, kind of in a similar boat there. And then if you get a little bit to the next layer of like what allows those bacteria to really thrive, well, it's fermentable carbohydrates. So it's carbohydrates that gut bugs can metabolize. And technically all grains are fermentable. So if you really want to go further, you could actually do, all grain avoidance. There are a few starches that also are fermentable: sweet potato, and corn, and several sets of beans that also have fermentable starches. So there's a whole diet based off of this concept called the GAPS diet, or the specific carbohydrate diet. And the concept is that you remove fermentable carbohydrates from the diet, and it basically causes those opportunistic flora that have, flourished to starve and be replaced by the commensal beneficial flora. And there's really good information online. There's a book that's been written. We have a lot of handouts at the clinic. But it tends to be a diet that I really like to use with these really big dysbiosis issues. And I like it because there's two aspects to it that really help people, which is there's an introductory diet. So there's a very methodical way to build complexity of foods and heal the gut that is a stepwise progression that patients really have, a really clear guidepost. And there's also a really big emphasis on gut healing foods, which specifically there's a lot of emphasis on bone broth, which is really nourishing to the intestinal lining. And there's a lot of emphasis on fermented foods, which of course the probiotic beneficial bug conversation is really helpful. So, that's the GAPS diet in a nutshell. And from a principle standpoint, that's the most important thing I think to articulate. Everything else is a little bit more of an individual conversation. Like people with really poor digestive enzyme output probably have them eat a lot less raw food. People with an A blood type, I might not be as heavy on the animal meat. And so I guess I want to just say it's a really complex individual conversation, what to ascribe to prescribed each individual. And just because I say GAPS diet doesn't mean it's going to be perfect for everybody, but generally it's one that I've found a lot of benefit from. And, the essential premise is get rid of processed food and really limit fermentable carbohydrates. And that's really going to shift the microbiome, which is going to in turn repair the intestinal function. Yeah.
What are your feelings and thoughts on kombucha?
Kombucha's okay. It has quite a bit of sugar in it, so that's my biggest concern. It's my least favorite fermented food. I'd way rather go for fermented vegetables, kimchi, sauerkraut. I'd rather go for miso. I'd rather go for even really good cultured yogurts for most people. before I would go for conversion. Yeah.
How long would someone stay on the GAPS diet?
Yeah, great question. Depends on the severity of pathology and the vitality of the patient. So people who have pathology for decades may need 6 months or more on it. People who have relatively new issues, we may be able to do it for a month and get really dramatic results. So I think somewhere in that window is realistic to make the adjustments. And you know, the body goes through a big adjustment period switching gears. And I always warn my patients about what that process is like.
Because eventually you need the fermentable carbohydrates, right?
Not necessarily, but I think that long term, a GAPS diet does not need to be lifelong. I think it's possible to heal your gut, and when it's healed, having some fermentable carbohydrates, when you have that nice healthy carpet of commensal flora, it's not going to be enough to dislodge, you know, that ecosystem. Yeah, Carl?
So I understand you're, I'm assuming, staying pretty much with your blood type diet.
Yeah, I mean, that's a more individual conversation. I'm not bringing blood type into this conversation, just this is going to like really confuse the topic. It's a whole different set of principles. I do personally, with my patients, use a lot of knowledge of blood type to give some basic guidance around nutrition. So a lot of times I'll overlay the blood type information with GAPS.
That fermentable thing doesn't work in my blood type, so let's
Yeah.
do something else?
Yeah.
Yeah, there is.
Right. Yeah, exactly. So, yeah.
Is there like a general rule of thumb as far as if you're doing fermented foods like sauerkraut and so on?
Yeah.
Like
How
every
much?
meal, once
Yeah,
a day?
I mean, I think you could have a little bit, a few teaspoons with each meal if you want to, or a couple of tablespoons once a day. I mean, there's no hard and fast rule, but yeah, I mean, how much fermentable foods, like, do you do per day? You could do a little bit with each meal, a few teaspoons or a couple tablespoons once a day. Yeah, great idea to do it. Yes, in the very back.
You mentioned the transition period.
Yeah.
Which I've experienced that myself.
Yeah, saw a lot of the die-off and stuff.
Kind of miserable.
Hard,
My
yeah.
question is it safe to make a big change like that when either pregnant or breastfeeding?
I like to really be careful and individual. I've done it with people. I don't prefer it. But if it's like, if your gut's really messed up and you're in that situation, it's causing harm. So we just have to be really careful about it, I think. I don't think it's an absolute no. It's just very cautious. Yeah. So the diet part, you know, is a big deal, obviously. There's a lot of ways we can help this process out. So the person who wrote the GAPS diet says, it might take 2 years for this to heal your gut. I'd like to think we could do better than that, and part of how we can do better is adjunctively support the process of digestion and healing. So there's several constituents I really like for that. Someone asked about probiotics, so I'll mention probiotics, right? Conceptually, if we sprinkle good bugs in the gut, it's going to help seed that microbiome to promote the beneficial flora. So to do that therapeutically, I usually like at least 25 billion organisms. I tend to make sure it's a really reputable company. It's a refrigerated probiotic. I have a couple I really like that I use. Claire Labs is one of them. They do a great job with probiotics. I'm not big on prebiotics. I think we get our prebiotics from all the soluble fiber we eat, so that's why I give probiotics with food. But, you know, I might go up to 50 billion organisms or more in one of those people that really has a compromised microbiome for a sustained period. Sometimes we have to do some other work first before we get to the probiotics. And the analogy I'll use is like if your yard is just full of weeds and you want it to be grass, you don't go in and just sprinkle seeds of grass, right? You kill the weeds and then you put the seeds of grass in, right? So sometimes with folks that have really disrupted microbiome and a lot of opportunistic flora, we'll actually use herbal antimicrobials with proper elimination and working on making sure the toxins are leaving the body as you kill them, to remove a lot of that opportunistic flora and then go in and seed the gut with healthy bugs. This is not like taking an antibiotic. The beautiful thing about herbal medicine is that we have a lot of great compounds that selectively take on opportunistic bugs versus kill the beneficial commensal flora. So I'll often do those protocols with individuals in a very specific way, always making sure that elimination is working well. I'm a big fan of feeding the gut lining, so I mentioned bone broth is great for that. L-Glutamine, the amino acid L-Glutamine, is really great for that too. So I might use pretty high doses of that when we're repairing the lining, like 15, 20 grams a day in a powder. Love that tool. Slippery elm has a very similar action in the body. That's an herb. I'll use slippery elm powders and water. Can work great. Remember I talked about the fight or flight response and how so many of us are in that pattern? Well, a lot of us need support with breakdown and assimilation. So enzymes for the pancreas, bile acid kind of mimicking agents for the liver gallbladder, hydrochloric acid or bitters for the stomach. These can be critical and helpful in the process of helping the complete breakdown process happen. So those are a few things, to bring to the table. Lots of other compounds, I draw from in my pharmacy, but if I'm really hitting on some of the biggest, most important agents, I would say those are a lot of the things I look to when I'm working on gut repair and healing. So, questions. I know I just ran through a lot, but I'm trying to be respectful of people's time.
With the glutamine,
Yeah.
I know the instructions
Yeah.
mention no food and just water, but I think you've mentioned to me before that it can be put
Yeah.
in a smoothie or something for my child.
It works a little better in water away from food because it'll work less as a food and more as a medicine. But it still works if you do it in food or, beverage.
Okay.
Yeah.
What do you think of the DGL with the liver
Yeah, DGL can be nice. It's very similar to slippery elm. It does a nice job helping the mucosal lining, but it's more for the upper GI versus the area we've more been focusing on. But for things like reflux, heartburn, gastritis, which is inflammation of the stomach lining, I love using it. It's a great tool. Yeah. Yeah.
If we make an appointment and come to see you, I would understand. How do you find out which of these would be most beneficial to your system?
Yeah, it's an individual conversation. It's really based on the unique presenting features of that rich tapestry of your health that I kind of started by talking about. And we kind of discern from there. I do not have a one-size-fits-all model for anybody.
An appointment is the best idea?
Yeah, I think if you have issues that you really want to directly focus on, absolutely. That's partly why I'm here, is to offer this opportunity to chat, but also say if you really want to individually dive in, come to the clinic and we can do that. Other questions about the topic, what we've just been talking about that I can go over with you guys? Yes?
So my understanding of some parts of the gut dysbiosis is
Yeah.
that, because there's so much communication through the vagus nerve.
Yeah.
the little-
Great thing to talk about, the
The
vagus
guy
nerve.
down there saying, give me the sugar, so there's, the cravings.
Yeah.
Do you use L-Glutamine as a way to balance blood sugar?
I do, and cravings. Yeah, I've used it for that too. It's a nice tool for that. Yeah. Yes?
Is stress the only factor that inhibits enzymes being secreted by the pancreas?
No, and actually, this is where it's like a vicious